The following program contains material that viewers may find unsuitable for younger children. A parental control system is advised.
And thank you for joining us on this special presentation here at the Derana News Channel. Today we're going to be talking about a topic that is very relevant in recent times, specifically because we just passed Breast Cancer Awareness Month as well. That is on breast cancer awareness and also to understand the surgical aspects of it as well. Not just about, checking and being preventative, but also what happens if the inevitable does actually get confirmed. To speak about this, we have two individuals that are very much suited for this program. I'm glad to have them on the program. A very warm welcome to Dr. Chan Ching Wang, the consultant breast surgeon, and also Dr. Wong Chung Ing, who is a medical oncologist. Safe to say we're in very good hands when it comes to this specific topic. It's going to be a very complicated one, but hopefully we can try and break it down and make it a little bit more digestible for our audience here today. I'd like to get right into the discussion. First off, let me ask you, Dr. Wong, specifically about detection. Can you tell us what individuals should look out for when it comes to the early detection of breast cancer? Specifically, how exactly? Now, we have this, information floating around in the public sphere, but can you tell us point by point, what are the most essential facts to check if you are suspecting breast cancer?
Yeah, so first of all, I think thank you for having us, in this program. We are very glad to be here in Sri Lanka. Well, I think breast cancer is something that is very, very treatable, okay? And to be honest, first of all, we need to look out for signs and symptoms, okay, of breast cancer. So things that we need to look out for are really breast lumps. Most breast cancer present with breast lumps, but again, I want to reiterate, most of the breast lumps are actually not cancer, okay? But it presents most commonly with a breast lump initially. So a breast lump that's hard, that's mobile, and doesn't go away. We need to be very aware of that and get it checked out. We need to look for, skin changes around the breast. We need to look for nipple discharge. We need to look for inversion of the nipple. So how do we detect breast cancer early? Really is by doing a few things, okay? Number one, we need to go for breast cancer screening, okay? So at the age of 40, we would recommend for women to go for mammogram and also ultrasound if possible. The other thing that we need to do is breast self-examination. That's probably the most important. It needs to start from age 20, and we usually recommend doing this every month, okay, starting from age 20, and preferably do it at the same time every month, 7 days after your period, when the breast is the softest.
Yes, that's very important for us to understand as well, the time and also the frequency at which we must continue to detect. Because a lot of individuals might have this opinion that, once we check once in a while, that should be totally enough.
Yes.
But of course, as we have seen, there's been some rising numbers when it comes to breast cancer as well. So it's always better to be on the lookout. Dr. Chan, can you please give us now, on the surgical aspect, considering you are a consultant breast surgeon, can you walk us through what are the main types of breast cancer surgeries that are available, and also how do doctors come to the conclusion of which is best for a patient?
Right, okay. So the main purpose of surgery is to eradicate or remove the cancer in the body. And so when I am assessing as to what type of surgery is possible, we have to look at the size of the cancer, and we have to look at the size of the breast that the cancer is in. So there are two main groups of surgery. One is we remove the whole breast. The other one is that we just remove a portion of it, and we can then leave the rest of the breast behind, but the remaining breast tissue has to be protected by additional treatment, which is radiation. Okay, so it's not very common, but some patients actually are not suitable for radiation, and then in which case they only have one choice, which is to remove the whole breast. But if we are able to perform radiation, we can save the breast, which is then called breast conserving surgery. To be fair, breast conserving surgery has been evolving, so much so that In the past, we would normally restrict it so that if you want a ballpark figure, if the cancer is, in terms of its size, about 10% of the volume of the breast, okay, so 1/10, breast conservation is very possible. If you go up to 20% that needs to be removed, you get into the territory where you will leave some form of deformity in the breast if breast conservation is done. And certainly any volume larger than that would leave a significant deformity. And so in the past, we will only say breast conservation if we only had to remove up to 1/5 of the breast. Anything else, I would offer a mastectomy, and which is a total removal. But like I said, techniques actually for breast conservation have been evolving. So now we've actually adopted a lot of plastic surgical techniques where I can move tissue in or I can move tissue around. And this actually gives me the freedom to remove more breast tissue and yet still reshape the breast so that it still looks natural in shape. And then if in certain cases, I can still also maintain the size.
Yes, of course, the cosmetic aspect of breast surgery for breast cancer is something that's a very contentious topic as well, because, I mean, at the end of the day, you fought a disease and you survived it, and it is a mark that you have survived it, but there's also the, public opinions of conventional beauty standards that could affect how you go about approaching surgery as a patient as well. Dr. Wong, I want to, Dr. Chan, I want to ask you specifically, just before we move on, I want to ask Dr. Wong as well about the symptoms, about the symptoms as well, what we should not ignore at all in early detection. But before we get to that, I want to ask you, Doctor, as a surgeon, in your opinion, can we check now specifically about breast conserving surgery? In your experience, has it been the more popular option for patients to opt for something like that? As you mentioned, there are cases where it is not an option at all. But in your experience, do women or individuals that have been affected by this cancer tend to choose or gravitate towards conserving what is left of a breast?
I think because that actually has a very heavy cultural bias. Certainly in Asia, and so in Singapore where we are from, it's probably a 60-40 split in favor of mastectomy. That means removing the whole breast. On the whole, many patients feel that when they remove the whole breast, they feel it is safer. We do tell them that saving the breast with the radiation is actually as good as removing the whole breast, but somehow it doesn't completely allay their fears. And so while on the one hand, I know it's safe, I also don't want my patients to be worried, and especially to worry about nothing. And so then it is a choice. And so I usually sit down with my patients, I tell them what is possible. We can do this and we can do this. Which one do you feel is the better option for you? There's no wrong choice. If you are suitable for breast conservation, but you want to remove the whole breast, it's fine. I think the flip side, though, is if you need a complete breast removal, it's usually very difficult to then do conservation, even if you wanted to, because it just means that the amount of volume that needed to be replaced was too large that to manipulate with the local plastic techniques. And then total actually would give you a better option. Or result.
So as I'm understanding, it's both completely viable options, but
yes,
there are, the flip side of the coin for both exist. Doctor, I want to direct this question to you specifically relating to the signs and symptoms. Now, we just understood through you how important looking out for and being aware of and doing regular checkups can be. If there's an individual that might suspect breast cancer, rather than, touching and feeling, there might be other symptoms that are auxiliary symptoms that could arise. Can you tell us what kind of symptoms you think are red flags and you should not absolutely ignore in any case?
Yeah, so I think the first thing is the breast again, so we talked about, breast lumps, we talk about nipple changes, we talk about skin changes. So these are local symptoms of breast cancer, and if we can catch the cancer at this stage, okay, that would be most ideal, because if we were to have this cancer spread to other areas, then it is not favorable. So let's say if the cancer has spread to the bones, some people can get bone pain. Some people, if have gone to the lungs, they may feel breathless or cough, or to the brain, they may have headache, dizziness, weakness. So I think before it gets to that, I think the most important thing is to focus on the breast first, and I think it's best to catch it at the early stage.
So what I'm understanding is breast cancer, the easiest and most early detection is if we keep giving attention to any changes that are happening in that area.
Because usually when you are diagnosed with breast cancer, we actually stage it. Right, that's stage 1, stage 2, stage 3, and 4. So stage 1 means that it is actually just localized in the breast and it's very small. Stage 2 means that it's a bit bigger, may have involved some of the lymph nodes beside the breast. Stage 3 means that it's even bigger and more lymph nodes are involved. And at stage 4, it has spread to other areas such as the liver, the lung, the bone, the brain. So if you diagnose a breast cancer at stage 1, the survival of this breast cancer can be as high as 95-96%. And subsequently, as it is detected, at the later stages, for example, stage 3, probably the survival is maybe about 60%. And at stage 4, actually, it's not curable, but it's certainly still controllable. But it's something that is not curable.
Right.
Yeah.
Before we get to stage 4, there are plenty of opportunities if an individual is aware enough to try and catch it as early as possible. Speaking of the stages as well, Doctor, I want to continue with this line of questioning specifically related to the, how prone an individual can be to contracting breast cancer. Can you tell us if there are specific risk groups or maybe there is a genetic disposition to contracting breast cancer? Are there groups that are at risk right now, or is it just a level playing field?
Yeah, so when we talk about risk factors of breast cancers, are usually divided into risk factors which are modifiable and risk factors which are non-modifiable. So non-modifiable means we can't change it. So for example, being female, because we have hormones, okay? And 70 to 80% of all breast cancers are stimulated by hormones. So being female in itself is a risk factor. Therefore, we have to be more aware. But male, by the way, can also develop breast cancer. So it's not. It's also something they need to be aware of, but much rarer than females. Then number 2, actually the most common is the most common non-modifiable risk factor is age. As we grow older, the risk of cancer, be it breast or any other cancers, colon, they are all higher, okay? Because as we age, our cells are damaged and it cannot repair itself. Therefore, age itself is the main risk factor for breast cancer. Then the other thing is genetics, okay? So if you have an inherited mutation that increases your risk of breast cancer, then it's also something we cannot change. So if we know the story of Angelina Jolie, so what she has is an inherited mutation that increases her risk of breast and ovarian cancer, and therefore she actually prophylactically removed her breasts and her ovaries. So if you have a family history of multiple family members with cancers, be it not only breast but others like ovarian, pancreas, prostate, or these family members have developed cancer at a very early age, then it should raise a red flag that you have some faulty mutation in this family tree, and therefore you need to be careful. All right. So the modifiable risk factors, okay, are things like our lifestyle, okay? So we shouldn't be too overweight, because being overweight and we eat high-fat diet, these all, are not healthy, okay, and increases your risk of cancers. And also smoking and alcohol, these are general risk factors for which we can modify to reduce the risk of cancers.
There are certain steps that we can proactively take as well as individuals to lead a better lifestyle in order to prevent, modifiable risk factors so that we can be as safe as possible.
Yes.
I want to continue this discussion as well with the both of you relating to what we can expect to see post-surgery and also maybe for future care as well. Before we get into any of those specifics, let's take a very short commercial break. You're watching Special Presentation. We'll be right back. You're watching a special presentation on breast cancer awareness, and we are joined by Dr. Chan Ching Wang, consultant breast surgeon, and Dr. Wong Ching Ing, medical oncologist. Thank you very much to the both of you doctors for giving us a very insightful first segment. We do not have as much time as we would need when it comes to discussing all the aspects of breast cancer and the awareness related to it, but I believe we can touch on the most essential points. Dr. Wong, I want to ask you, sorry, Dr. Chan, I want to ask you specifically relating to during surgery as well. What exactly is your process in order to detecting cancer while surgery? Now, we understand that mastectomies are the most popular, but when it comes to lymph nodes and detecting if the cancer has spread, what is your process on that when a person is under the knife? What exactly is your procedure?
I mean, essentially, it's actually a very logical thing, but so we know how cancer cells can travel to the lymph nodes, and so we exploit that particular, that particular phenomenon. It's actually it's an anatomical structure. So there are lymphatic channels and fluid channels in the body that conduct fluid all around. And so for the breast tissue, when the fluid drains, it will actually drain out to your armpit area, and then it will enter the circulation, and then it then circulates around. And so it is because of that path of drainage that allows us to then track and map out the lymph nodes that if cancer has started to travel, we are able to locate the first 1 or 2 lymph nodes that it would go to. And so when we are doing what we call sentinel node biopsy, this is where at the point of time we feel that it is unlikely to have spread, but we want to be sure. And so we are trying to see if there is microscopic disease. So this is disease that is too small to be seen on any scans. And so the only way we can do it is to remove the lymph node, section it, and look at it under the microscope. And so we can do this at the time of surgery. So like I said, we map out and then we find the lymph nodes that are most likely to be the first to be affected. We remove them, and usually this will be about 1 or 2, and then I send them to the lab, and my doctor who is there literally takes a couple of slices, looks at it, and see whether there's cancer there. And then they will tell me within about, depending on how fast they are, but it's usually about 45 minutes, yes or no, or tiny bit. And the reason why that is important is that actually, if you look at the whole way surgery for the breast is evolving, we're actually trying to get smaller and smaller. So we're trying to conserve more and more. And while the breast may not always be conserved, I think we try harder to try and conserve lymph nodes, because if we take too many lymph nodes away, you actually run the risk of getting a heavy swollen arm, and this actually then can affect how my patient survives, recovers, and quality of life in the future. And so if I do not need to remove lymph nodes, I try very hard not to. We do have a lot of protocols in place, and these are actually generalized guidelines that all surgeons, once they know about them, just need to follow, and you're doing the right thing. And so yeah, you test lymph nodes. If they have a problem, you then decide, is it a big problem or a small problem? If it's a small problem, I may still be able to leave lymph nodes behind. But if there actually is a significant amount of cancer in the lymph nodes, then it is far better to clear it and remove them.
There's a lot of calls that have to be made on the table in order to ensure a proper quality of life.
Correct.
And a better survival rate as well for the patient.
Yes.
Speaking of now, we have been having, because thanks to Dr. Chan, we have had a lot of insight on the surgical option for treating breast cancer. But Dr. Wong, I want to ask you, breast surgery is specifically mastectomies and maybe lumpectomies. They're not the only forms of treatment for breast cancer. Dr. Wong, can you enlighten us on what other forms of breast cancer treatment there are?
Well, wow, that is going to be, because breast cancer is actually treated as a multidisciplinary approach, all right? Essentially, we need to involve our surgical colleagues, we need the pathologist, we need our radiologists to read the scans, and so it's actually a team effort, and that's why, we work together very closely, especially in Singapore, we have all this multidisciplinary team to look after patients. So So when the patient is diagnosed, okay, so if they are amenable for surgery, we will go for surgery first, okay. Following that, you will see what stage this cancer is, and then following that, we'll decide whether further treatment is actually necessary, all right. So further treatment will usually involve things like chemotherapy, all right, because what happens is that after the local disease is controlled, we will want to sort of give some chemotherapy if indicated to eliminate the microscopic disease that we cannot see in the body. Then, like Dr. Chan has alluded to, if we had done a breast conserving surgery, we will get our radiation colleagues to come in to give some radiation to that affected breast, again sterilize or give more local control to that breast. Then after that, we will also check on the tumor cell, okay, certain things like what stimulates the growth of this cancer. So we would like to see whether it's stimulated by hormones, whether it's stimulated by other, targets. One of the commonest target is the HER2, is a receptor that is present in about 20 to 25% of all breast cancers. And as we said before, hormones are present in about 70 to 80% of breast cancers. So if any of this is positive, then usually we will give some hormonal treatment or HER2 targeted treatment, again to eliminate all the microscopic disease that we cannot see. But in the context of metastatic disease, let's say this has spread, although we say that it may not be curable, but certainly now we have got a lot of drugs that we can give to control the cancer, preventing them from spreading further, getting it better so that we can give them a better quality of life and hopefully to prolong survival. And all these are also guided by all these targeted therapy, what we find on the cancer cell, and from there we decide, what we can give to the patient. So this will involve things like hormonal treatment, HER2 targeted treatment, immunotherapy as well. Immunotherapy where we actually stimulate the own immune system to fight the cancer, and we also check for this mutation that we talk about. Whether they have this inherited mutation, and if they have that, we also have a targeted drug. So the concept of metastatic disease treatment is actually more guided by targeted treatment, whereas where they are not spread, we are aiming for cure, then we will involve, the surgeons, radiation oncologists, and also targeted treatment as well. Yeah.
A team effort indeed.
Yes.
It takes a village to make sure that the patient has a proper survival rate and also better quality of life. Dr. Chan, I want to ask you now, following surgery, post-op, can you tell us about what life could look like for an individual that has undergone, either of the types of surgeries that you have mentioned previously?
Okay, first off, breast surgery is very easy to do and it's very easy to recover from because it's actually a surface operation. It doesn't involve any of the important organs that keep you as a person going. Yes. And so unlike other surgeries in other parts of the body, the recovery is actually pretty quick. So if you're talking about simple breast conservation, you're probably back to normal within 2 weeks. And if you did a total mastectomy without reconstruction, again 2 weeks. If you did it with reconstruction, I would say 4 to 6 weeks. And then you would be pretty much back to your normal self. You may not feel completely normal. Certainly the body that has been operated on does feel different. And it does take some time to get used to your new body, but you should always ask your doctor what can be done and what is safe to be done. But usually, in terms of, say, getting back to normal physical activity, I would say from 2 weeks onwards, you should start gradual exercise. And swimming is very good if you are able to, because it involves a lot of arm movements. And actually, because it's in the upper chest, and sometimes we go into the armpit area, a lot of my patients do find the arm, especially the shoulder, gets very restricted. And they are scared to move it, and that just compounds the problem. And so early movement is actually very important. And you actually can do a lot of things. You don't have to restrict yourself. My patients ask me diet. I just say eat as normal and exercise as normal. Once you feel that you're capable of doing it, just go ahead. You may have to go, if you're a very active person and you used to do a lot of exercise, then I'll say, okay, you go it slow. You take a break. You don't expect to go back to normal like that, okay? You take it in steps. And so firstly, you would say, okay, 15 minutes. in the past you were used 1.5 hours, start with 15, then half an hour, then 45, you gradually step it up. You don't expect to go back to normal straight away. It's actually little small steps.
Yes, small steps. I think that's essential as well, because in Sri Lanka specifically, there's always this notion, maybe it's there across the globe as well, after surgery, it's almost like the patient is fragile and delicate, but actually there needs to be some sort of rehabilitation in order to continue with their daily life with as little interruption as possible. Dr. Wong, on a related note, specifically relating to support that can be provided by loved ones to patients, and also the support that patients can receive. What's it looking like right now in the current climate for post-op?
So I think be it post-op or post-treatment or chemotherapy or whatever treatment we need to give to them, I think it is very important to to make sure that they are both mentally and physically well. So physically, as Dr. Tran has said, we will give rehabilitation. And in terms of all these side effects that we give, chemotherapy and the rest, nowadays we have a lot of medication to actually mitigate all these side effects. So, but on top of that, I think again it's a multidisciplinary team. In the Parkway Cancer Center where I work, we do have dietitians, to help them to advise them on their diet. We do have also counselors to support them, mentally, give them some, coping mechanisms, because it's really not easy. This is not only just the patient, but we also like to support the caregivers as well, because they're actually in this all together. So, and we also, of course, we don't have physiotherapists, but we work with a team of physiotherapists together with Dr. Chan's team, and to help them to physically rehabilitate after their treatment.
So we have hope, and it's never always just a dead end. There's a lot of support that happens before, during, and after the entire ordeal. And of course, cancer in any form is not going to be easy mentally or physically on anyone. So it's great to know that there are support mechanisms that are in place for those around the patient and also the patient themselves. There are a few more questions I want to get into, specifically when it comes to the public awareness on breast cancer as well, considering this discussion could be considered as a public service announcement for breast cancer. But before we get into any of those specifics, let's go in for a short commercial break. You're watching special presentation on Other Derana News channel on breast cancer awareness. We'll be right back. Welcome back to special presentation on breast cancer awareness here on Other Derana News channel. We got into a lot of details relating to the technical aspects and the procedures and what life looks like as someone that has survived breast cancer. Thank you very much to both of you doctors here today. Unfortunately, we are running out of time. We don't have quite much time, but specifically when we ended off, Dr. Wong, you spoke about support that has been provided to the patient and also to relatives. In Sri Lanka specifically, we have quite a few cancer trusts and cancer societies that are run by the Ministry of Health, and also the Sri Lanka Cancer Society. There are cancer survivors support networks as well, and a cancer care association that runs, all with the help of Ministry of Health. So it's very important to know that you're not alone with all of this. If there is someone that is suffering from breast cancer, there are so many individuals that have lived your tale and have also, triumphed against the odds. On that note, Dr. Chan, I want to ask you about what you see as, now Sri Lanka might be a different environment, but what do you see in your case, having dealt with cancer patients, breast cancer patients for your entire medical career? Tell us what it looks like when it comes to not just support within nuclear families, but also community support, communal support in your environment.
So I think, given that social media is becoming increasingly accessible, a lot of my patients, especially the younger ones, they tap on social media. And I think that actually is very good, because apart from the local patients, and they do also talk to friends, family, I think because breast cancer is increasingly common, most people will know someone who has had it or is going through treatment for it. And they will network, because I don't know about, I've been blessed and not had it, but I know whenever you talk or when you've gone through something, you are willing to share, to help others when they go through it, to tell them that this is not the end. There really is an end in sight, and then after which you will start recovery. And I think the more people you have telling you that, because you can then see as well all the survivors, and you see that, they've gone back to normal. I can do that too. It is a real mental, how to say, light. That one, no medicine can give to you, you know? And the spirit, that one actually makes a lot of difference. I've had patients who have always been very depressed, and you always see them and you know that there's just something not quite right, and at some point something does happen. And then I see the bright, cheery ones, even if they have very bad disease, somehow they're good. And so you know how you look at things and how you challenge it does make a difference, and it's always good when you have support. You always feel that you're alone. And breast cancer doesn't tend to run so much in families. There's actually only 10% has a familial drop down, and then you have family support. But a lot of ladies are the only one in their family with it. And then for them to then look for support outside, you have to look into the community. And I think what I appreciate about culture, especially what I've seen about the Sri Lankan culture, you're very, very community-based. So it's beyond just your immediate family, your neighbors, your village, your town, you know? You guys have a lot of support that way, and I feel that you should tap into it.
Yes, that's an essential point that you mentioned as well. As an individual that has a family member that underwent surgery for breast cancer, it's quite heartwarming to see that Sri Lanka has an accepting climate for individuals with breast cancer, and that's why programs like this are also necessary in order to up the awareness and make sure that early detection is possible. Dr. Wong, on a similar note, specifically relating to what you can expect to see, now there might be things that individuals will not expect as side effects of undergoing treatment, or maybe things that you wouldn't have expected to impact your lifestyle in any sort of way, because when we mention chemotherapy or radiation, we understand what the concept in it is, but maybe there are some points that we could forget to consider into the equation of how we're going to live our daily lives. Can you tell us, Dr. Wong, about some points maybe you can point out and shed some light on where patients can expect to see a little bit of a difference, a bit of a diversion into their normal lifestyles?
Yeah, so I think nowadays we are seeing breast cancer in younger women, unfortunately, and hence why screening and self-breast examination is so important. I need to reiterate that again. So one aspect is fertility and sexual relationships. Okay, maybe I won't be elaborating that much in this platform, but I think it's a very real problem, and it's something that, however, people don't talk about very much. So that is another aspect of treatment that we need to really focus on. Menopausal symptoms is another thing, even for the older women. So, but I want to tell women out there, even though we may develop this kind of side effects from treatment, but then again there is a lot of psychosocial support, okay, and also things that we can help to manage all this. There are also some medications that we can give, okay, but the thing is that they need to be able to open up and whatever symptoms they have got, be it something that they can or cannot talk about, they need to highlight it to the treating physician, highlight it to your relatives, and so that you can get the appropriate treatment and support.
Yes, the appropriate treatment and support aspect is well, obviously quite essential. But when it comes to community support, as both of you wonderful doctors mentioned, there is a plethora of options available for individuals to help cope with their reality of having breast cancer. Dr. Chan, we don't really have as much time as we'd like to have, but I want to ask you, relating to now quality of life after surgery. You mentioned that individuals can go back to being mostly normal 2 weeks post-procedure. Can you tell us, doctor, if there are some special things that, apart from exercise and staying a little bit active to help rehabilitation, are there pointers that you'd like to tell our audience, to tell our viewers, relating to how to better handle being, coming fresh out of surgery for breast cancer?
I think the main thing is actually not to be so fearful of letting your body do things. A lot of my patients feel that, oh, I can't move that part. And so they try and move the rest of the body, and then they try and keep this part as still as possible because they feel that it's going to tear, it's going to open up. And no, I mean, if it does, then you've got the wrong surgeon. And I know it sounds as though I'm joking, but it's actually very real. So no one's wound is going to open up unless there's a bad infection, okay? So firstly, you have to get over the fear of moving. And then there's pain. There will be some pain. And then depending on how you perceive pain, some people are very sensitive to it, some are not so. I would just say take your pain meds regularly as you need to. It's not that you're going to get addicted to them. And so you cannot restrict yourself that way. And if you find that there's anything that concerns you, whether, oh, should I be doing this, can I do it that way, check with your doctor. Because they will be able to tell you, that's safe, go ahead. Or, oh, that's a little bit dangerous, so there's this, it's like, step back, not be so vigorous and things like that. But,
there's a guideline, and your physician, whoever is...
Correct. Well, like I said, actually breast surgery is extremely easy to recover from. Most people get by without any regular... You don't really need a specific regime. It actually will recover quite fast.
So this kind of conversation will be very heartwarming and also very assuring for individuals that might fear going under the knife for this kind of procedure. It's great to know that we've come a long way and now in modern day we can actually, go back to being who we were before any of the detection or cancer even happened. Yes. We are, unfortunately, this is probably going to be one of the last questions that I could ask. Dr. Wong, very quickly, for the audience, that is the viewers that are watching, as an individual, as a physician, as a doctor, that can give us a little bit of a more rounded outlook on what you can expect, not just before detection, during, after. What are some lifestyle changes or maybe some pointers that you can give in order to help? Well, maybe it won't help prevent, but it could help, ease of detection or even lower the possibility by a significant amount. What are some things that you'd like to convey to our viewers specifically relating to that?
Yeah, so I hope that, from today's program, patients or everybody out there will know that, breast cancer is actually very treatable, okay, and very curable. What we need to do is that we need to watch out for all the signs and symptoms, and that we need to go for our regular screening and breast self-examination. I can't emphasize that enough, because if we detect breast cancer at a very early stage, it is truly a very curable disease. But in the unfortunate circumstance that if we do need treatment, we want to know that there are not now a lot of treatments that are available, and it is manageable, the side effects. And in order, but before again that, we need to also make sure that we, change our lifestyle, things that we can modify. So make sure we do a regular exercise, maintain a healthy weight, eat a healthy diet, and really prevention is always better than cure, right? So this is what I would say to the audience today.
Prevention is better than cure. That is an ideal point for us to unfortunately end off this discussion on. Thank you very much for joining us to educate the public relating to this very, very pertinent issue. Dr. Chan Ching Wang, consultant breast surgeon, and Dr. Wong Ching Ing, medical oncologist. Thank you so much to both of you doctors for taking the time to come to the studio today.
Thank you for having us.
Thank you for having us. Yes.
And unfortunately, that's all we have for you tonight on this special presentation on breast cancer awareness. We value your feedback, so please do send us your feedback at feedback.adncenglish@derana.lk or via WhatsApp at 076-805-7933. Thank you very much for watching this special presentation on breast cancer awareness on Other Derana News Channel. Have a good night.